All right, gentlemen, I need you to lean in for this one, because what I'm about to share with you today is the kind of conversation most men never get to have. Not with their doctor, not with their friends, certainly not with anyone who actually knows what they're talking about. I've been a urologist for 22 years, and in those 22 years, I have sat across from men of every age, every background, every lifestyle, and I have heard the same quiet frustration over and over again. Doc, things just aren't working the way they used to. And almost every single time, almost without exception, when we dig into what's actually going on in that man's daily life, we find the same culprits. Not bad luck, not just age, habits. Daily, repeated, fixable habits that are quietly working against them. Today, I'm going to walk you through 10 things that destroy erections, things you may be doing right now, today, without realizing the damage they're causing. And here's my promise to you. By the end of this video, you will understand not just what to stop doing, but why it's hurting you, and what to do instead. This is the conversation you deserved to have years ago. Let's have it now. I'm Dr. Jocelyn, board-certified urologist, 22 years in men's health and sexual medicine. I make these videos because every man deserves honest, evidence-based information about his own body, delivered with respect, not embarrassment. If you're new here, welcome, my friend. Hit subscribe and join the community. We talk about the things most doctors don't have time to cover in a 12-minute appointment. And drop a comment right now. How old are you, and is this a topic you've ever discussed openly with a doctor? I want to know. I read every single one. All right, let's get into it. Before the list, I want to give you one foundational idea that ties all 10 of these together. Because once you understand the underlying mechanism, everything else clicks. Erections are, at their core, a vascular event. When arousal occurs, the brain sends signals down the nervous system, triggering the release of nitric oxide in the penile tissue. Nitric oxide causes the smooth muscle in the arterial walls to relax. Blood rushes in. The erectile chambers, the corpora cavernosa, fill. Pressure builds, and erection occurs. For that to work, you need healthy blood vessels, healthy nerves, healthy hormone levels, and a brain that isn't working against you. Every single one of the 10 habits I'm about to describe attacks one or more of those 4 systems. That's why they're so destructive. And that's why changing them produces real, measurable results. Think of your erectile function like a 4-lane highway. Blood vessels, nerves, hormones, mental state, 1 lane each. These 10 habits are roadblocks. Some block 1 lane, some block 3 at once, but every blockage slows everything down. Your job, starting today, is to start clearing the road. Let's go. Thing number 1, smoking. I'm going to start here because the evidence is simply overwhelming, and because I still have patients who smoke and genuinely don't connect it to what's happening in the bedroom. Smoking damages the endothelium, the inner lining of your blood vessels, directly and progressively. Every cigarette introduces compounds that cause oxidative stress, narrow blood vessels, reduce nitric oxide availability, and accelerate arterial stiffening. In the penis, where the blood vessels are among the smallest in the body, this damage shows up earlier and more dramatically than almost anywhere else. Erectile dysfunction is often one of the first clinical signs of cardiovascular disease in men, and smoking accelerates both. Men who smoke are approximately 40% more likely to experience erectile dysfunction than non-smokers. In men under 50, smoking is one of the leading causes of ED that doctors see. The good news, vascular endothelium has remarkable capacity to recover. Men who quit smoking often report meaningful improvement in erectile function within months. If you smoke and you are frustrated with your performance, quitting is the single most impactful change you can make. Full stop. Thing number 2, drinking too much alcohol. I want to be careful here because I am not telling you that a glass of wine with dinner is destroying your health. The research does not support that. What the research is very clear about is this: chronic heavy alcohol consumption, and even acute heavy drinking on a given night, has direct, measurable negative effects on erectile function. In the short term, alcohol is a central nervous system depressant. It numbs the nerve signals required for arousal and erection. Shakespeare said it beautifully centuries before we had the neuroscience to explain it. Alcohol provokes the desire, but takes away the performance. In the long term, chronic heavy drinking suppresses testosterone production, damages the liver's ability to metabolize estrogen, increases systemic inflammation, and causes peripheral neuropathy, nerve damage, that directly impairs the signaling required for erection. If you are drinking more than 14 drinks per week, or regularly having 4 or more drinks in a single evening, your erectile function is paying a price you may not be fully aware of. Moderate, mindful consumption, 1 to 2 drinks on any given occasion, appears neutral for most men. It's the habitual excess that causes the damage. Thing number 3, sitting all day without moving. I told you these habits attack blood vessels, nerves, hormones, and mental state. Prolonged sitting attacks all 4. When you sit for hours at a time, at a desk, in a car, in a recliner, you compress the perineal blood vessels, reducing blood flow to the pelvic region. You reduce overall circulation. You lower your metabolic rate, which over time contributes to weight gain, insulin resistance, and inflammation. And you compress the pudendal nerve, the primary nerve involved in penile sensation and erectile signaling. Men with sedentary jobs and sedentary leisure habits have significantly higher rates of erectile dysfunction than physically active men, independent of other health factors. The fix is not complicated. Get up, move. Even breaking up long periods of sitting with a 5-minute walk every hour makes a measurable difference in vascular health over time. And as I discussed in my prostate video, daily pelvic floor exercises, combined with regular moderate aerobic activity, create a compound benefit for erectile function that is genuinely remarkable. I have seen men in their late 60s and 70s experience significant recovery simply by getting off the couch and training their pelvic floor. Thing number 4, poor sleep. Gentlemen, this one is not optional. Sleep is when testosterone is made. The vast majority of your daily testosterone production occurs during sleep, specifically during the deep, slow-wave sleep stages. Men who consistently sleep fewer than 6 hours per night have measurably lower testosterone levels than men who sleep 7 to 9 hours. One study found that just 1 week of sleeping 5 hours per night reduced testosterone levels in young, healthy men by 10 to 15%. Now add to that the fact that poor sleep elevates cortisol, which directly suppresses testosterone, increases systemic inflammation, impairs nitric oxide production, and reduces the brain's capacity for arousal processing. Poor sleep doesn't just make you tired. It biochemically dismantles the hormonal and vascular environment that erections depend on. I had a patient, Dennis, 63 years old, a sales manager, who came to me frustrated about what he described as a sudden and significant decline in his intimate performance over the prior year. When I asked about his sleep, he shrugged. "I sleep maybe 5 hours. Always have. I'm fine." He was not fine. His testosterone was in the lower third of the reference range for his age. His cortisol was elevated. His sleep study revealed moderate sleep apnea. We treated the apnea. We worked on sleep hygiene. Within 4 months, his testosterone had risen meaningfully, without a single hormone prescription, and his intimate function had improved significantly. Dennis still shakes his head about it. "I thought I just needed a pill," he told me. "Turns out I needed a pillow." Protect your sleep. It is not laziness, it is testosterone production. Thing number 5, eating a high-sugar, high-processed food diet. What you eat every day is either building the vascular and hormonal environment that supports strong erections, or it is quietly dismantling it. A diet high in refined sugars, processed foods, refined carbohydrates, and trans fats drives insulin resistance, systemic inflammation, endothelial dysfunction, and progressive arterial stiffening, every one of which degrades erectile function over time. Insulin resistance in particular deserves special mention. When cells become resistant to insulin, blood sugar rises, inflammation increases, and the production of sex hormone-binding globulin goes up, which reduces the amount of free testosterone available to your body. The result is lower effective testosterone, higher inflammation, and worse vascular health. All 3 lanes of the highway blocked at once. The dietary pattern that best supports erectile function is the same one that supports cardiovascular health. Abundant vegetables, fruits, whole grains, legumes, healthy fats, particularly olive oil and fatty fish, and lean proteins. The Mediterranean dietary pattern has the strongest evidence base for erectile health of any dietary approach studied. Specific additions worth making: leafy greens and beets for nitrate support, dark chocolate in moderation for flavonoid-driven endothelial support, walnuts and almonds for arginine and healthy fat content, watermelon, which contains citrulline, a precursor to nitric oxide. You don't need to be perfect, you need to be consistent. Shift the balance of your plate toward these foods and away from the processed ones, and your vascular system will respond. Thing number 6, chronic stress and unmanaged anxiety. Here is something that surprises many of my patients. The brain is the most important sexual organ in the human body. Every erection begins in the brain. Arousal signals travel from the brain down the spinal cord to the pelvic nerves. If the brain is flooded with cortisol, preoccupied with anxiety, or locked in a sympathetic nervous system activation, the fight or flight state, those arousal signals are suppressed at the source. Chronic stress is, neurochemically, the opposite of the state required for erection. The parasympathetic nervous system, the rest and digest state, is what enables sexual arousal and erectile function. The sympathetic nervous system, the stress state, actively inhibits it. Men who are under chronic occupational stress, financial stress, relationship stress, or health anxiety experience this inhibition daily. And the cruel irony is that performance anxiety itself, worry about whether an erection will occur, becomes its own source of sympathetic activation that makes the very thing they're worried about more likely to happen. Managing stress is not a soft recommendation. It is a direct intervention in the neurochemical environment that governs erectile function. Daily stress regulation practices, deep breathing, meditation, regular physical activity, time in nature, genuine social connection, are not luxuries. They are maintenance for the system you're trying to protect. Thing number 7, pornography overconsumption. I want to address this one carefully and without judgment because it is a topic that deserves honest clinical discussion and rarely gets it. The research on pornography and erectile function is still evolving, but a consistent pattern has emerged in clinical settings over the past decade, particularly among younger men, but increasingly among men of all ages. Men who consume pornography heavily and habitually can develop what clinicians sometimes describe as porn-induced erectile dysfunction, a condition in which the brain's dopamine reward system becomes calibrated to the high-novelty, high-stimulation environment of screen-based pornography, and real-world intimacy, which is lower novelty by comparison, no longer produces the same neurological arousal response. The result is a man who is physiologically healthy, good testosterone, good vascular function, good nerve health, but who cannot maintain an erection with a partner. I have seen this pattern in men in their 30s, 40s, 50s, and beyond. It is not a moral failing, it is a neurological adaptation. The intervention is a structured period of abstinence from pornography, typically 4 to 12 weeks, during which the dopamine system recalibrates. Most men who follow through report meaningful recovery of partner-based arousal and erectile function. If this pattern resonates with your experience, please discuss it openly with your physician. You are not alone, and it is entirely addressable. Thing number 8, ignoring your cardiovascular health. I want to say something that I say to every patient who comes to me with erectile concerns, and I want you to hear it clearly. Erectile dysfunction is a vascular symptom before it is a sexual symptom. The penile arteries are approximately 1 to 2 millimeters in diameter. The coronary arteries, the ones that supply your heart, are 3 to 4 millimeters. Arterial disease affects the smaller vessels first. This means that in many men, erectile dysfunction precedes a cardiac event by 3 to 5 years. The penis is, in a very real clinical sense, a window into cardiovascular health. Men who come to me with new or worsening erectile dysfunction, particularly in their 50s and 60s, receive not just a urological workup, but a cardiovascular risk assessment, blood pressure, fasting glucose, lipid panel, because addressing the underlying vascular disease is not just good for the bedroom. It may be life-saving. If your blood pressure is uncontrolled, if your cholesterol is high, if you have been told you are pre-diabetic and haven't taken it seriously, please take it seriously now, not just for your heart, for everything downstream from your heart. Thing number 9, certain medications that nobody warns you about. This one is not about blame, it is about awareness. Several commonly prescribed medication classes have erectile dysfunction as a known side effect, and many men are never told this when they start the medication, or they don't connect the timing. Beta blockers, commonly used for blood pressure and heart conditions. Certain antidepressants, particularly SSRIs. some diuretics, anti-androgen medications used for prostate conditions, even some antihistamines and stomach acid medications at high doses. I am absolutely not telling you to stop any medication without talking to your doctor. These medications exist because they treat serious conditions, and the risk-benefit analysis is real. What I am telling you is this. If you started a new medication and noticed a change in your erectile function in the weeks or months that followed, bring that up with your prescribing physician. There are often alternative medications within the same drug class that have lower rates of sexual side effects. You deserve to have that conversation. Your sexual health is a legitimate medical concern. Advocate for yourself. Thing number 10, suffering in silence. I saved this one for last because, in my clinical experience, it may be the most damaging of all 10. The man who notices changes in his erectile function and says nothing, to his doctor, to his partner, to anyone, is the man who waits. And while he waits, the underlying causes, whether vascular, hormonal, neurological, or psychological, progress unchecked. Silence is not stoicism. Silence is a missed window. I have had patients come to me who had been struggling for 3, 4, 5 years before walking through my door. Men who had quietly withdrawn from intimacy. Men whose relationships had suffered. Men who had told themselves it was just age, just stress, just how things were now. In many of those cases, not all, but many, the underlying cause was addressable, treatable, reversible at least in part. But time matters. Vascular health that might have responded well to lifestyle changes 2 years earlier is harder to recover when 2 more years of damage have accumulated. Relationships that might have been strengthened by an honest conversation early on are harder to repair after years of quiet distance. If something is changing, say something. To your doctor. This week. You are not less of a man for having this conversation. You are more of one. Gentlemen, let's bring it home. 10 things that destroy erections. Smoking, excess alcohol, prolonged sitting, poor sleep, a high-sugar processed food diet, chronic unmanaged stress, pornography overconsumption, ignored cardiovascular health, unexamined medication side effects, and silence. Not one of these is inevitable. Not one of these is permanent. Every single one is addressable, with information, with intention, and when needed, with the right medical support. Your body is not failing you. It is communicating with you. These symptoms are not the end of the story. They are a prompt to write a better one. Start with one thing from this list, just one. Pick the one that resonates most, the one where you thought, that might be me. Write it down and begin. Tell me in the comments, which of the 10 surprised you most? And which one are you going to address first? I read every comment and I want to hear from you. If this video gave you something useful, please like it. It helps other men who need this information find it. And subscribe, because next week we are talking about the foods that actively support erectile function and blood flow. The ones that work with your body instead of against it. You won't want to miss that one. This is Dr. Jocelyn. You deserve to feel confident, energized, and fully alive at any age. Stay strong, my friend. I'll see you in the next one.